The challenges of performing a PI-RADS assessment has changed vastly over the last several years with the improving MR sequences. And so now just the main issue is determining what really needs to be sampled, and if we're going to sample it, is it easier to do it in-bore with MR guided, or MR fusion biopsy, or just a traditional truss. We have found over the last, I'd probably say the last year, that doing direct MR guidance has been very efficacious. The morbidity has been very, very low. Our positive predictive value right now for finding Gleason 7s or higher have been close to around 70%, and that is really, really great for the patients. And so using a PI-RADS assessment, we have really found out lesions that really need to be sampled. Mint, as of last year, we've been using Mint for over a year, and what has been very, very essential is now you have a modality, or in the software rather, that is now allowing us to talk to a group of individuals which were outside of radiology. And so you have a urology group which traditionally have been doing 99% of the biopsies in prostate. The Mint has been able to give us these great images and reporting system to now be able to talk to the radiation oncologists, to the urologists, to the primary care physicians in a standard platform, so for which everyone else can understand exactly what the report and the information is. And so with that, Mint has allowed our business to grow, but it's also allowed for patient care to improve tremendously. Again, Mint, to us was introduced as a platform and doing a lot of PI-RADS. As we grew with them, we have found out that it's a software producing system that has been allowing us to do a lot of other issues in radiology. We are very active in MSK right now, and so Mint has allowed us to assess a lot of our patients post-procedure, such as in carpal tunnel, assessing the median nerve prior, and then having a sonographic guided treatments of a carpal tunnel, and then using Mint to reassess the size of the median nerve to show the improvement, and the patient is showing us improvement, but now we have hardcore data showing us the reduction in area of the median nerve, both distally and proximal to the carpal tunnel. My future, mainly in radiology now, is being less is more, and so with the Mint system and what we're doing now with prostate is being able to have patients come in, God forbid they have something that's abnormal on exam or lab values with the primary care doctor, they get a parametric MRI, the lesion or lesions are seen, the most suspicious index lesions are then sampled, and then with that, if they're sampled and they're high Gleason, is then go on to MR-guided possible HIFU treatment and focal treatment. So patients have more than just prostatectomy or radiation and focal treatment. You know, when I started, only thing that offered for patients in breast were major, mastectomies. Now focal therapy is shown to be more efficacious, and people's lives are being saved rather. And like the old saying, less is more. And I think Mint has been at the forefront of this.